Hey everyone, thanks for tuning in again. Today I want to talk about something that's been at the center of American politics for the past few years, but in a way that often gets buried underneath all the noise about culture wars, partisan fights, and election drama. And honestly, I think this topic deserves far more attention than it gets, because it directly affects every single household in the country. Mine included, probably yours too, and pretty much anyone trying to build a life in America today. I'm talking about the affordability crisis, not the abstract one, not a headline version, but the real, everyday struggle that millions of Americans are feeling. And I want to go deeper into one specific part of that crisis, the healthcare system, and the conversation around whether price transparency could change anything. America's affordability problem basically boils down to one major factor: the cost of healthcare, and the fact that it has become one of the least transparent, most complicated, and most expensive systems in the developed world. At the same time, I also framed price transparency paired with market competition as the most important reform that could fix the system. Now, I want to talk about that idea, because if we're serious about understanding America's affordability crisis, we need to talk about what's really driving costs, which policies have actually worked, which ones haven't, and why it's so hard to fix any of this. So what I'm going to share today is my own breakdown based on research, actual data, and the real lived experience of the American public about what's going on with affordability, why healthcare matters so much, and whether price transparency is truly the game-changing solution some people claim it is. This is not a partisan video. This is not a promo for any politician. This is not an attack on any administration. It's simply an attempt to cut through the noise and give a clear, balanced, fact-based picture. So let's dive in. If you look at the last two national election cycles in the United States, something interesting becomes clear. Despite all the political chaos, impeachments, culture war debates, border issues, foreign policy fights, voters across the country, regardless of party, sent basically the same message: life in America is becoming too expensive. You can see it in exit polls. You can see it in surveys. You can see it in interviews with voters in red states and blue states, in big cities and rural towns. People feel like they're working harder than ever, but still falling behind. What does too expensive mean in real life? Well, for a lot of families, it looks like this. Rent eats up half the paycheck. Groceries cost more every month. Childcare is basically a second rent. Car insurance keeps climbing. College tuition is absurd. And the cost of health insurance feels like paying for a second home you don't even live in. This isn't a fringe opinion. This is the mainstream experience. And it's not just the poor or the unemployed saying this. Middle-class families, people with stable jobs, good degrees, dual-income households, are also feeling squeezed. In fact, the phrase I hear the most from middle-class Americans is, "We're doing everything right, so why does it still feel impossible to get ahead?" That is the backdrop of every election, regardless of what candidates say on TV. When politicians talk about affordability, they usually focus on housing and inflation. And yes, those things are huge problems. But when you look at the data, one category stands out above everything else in terms of long-term cost growth: healthcare. In the United States, healthcare spending now accounts for nearly 1/5 of the entire national economy. No other developed country even comes close. And it affects everything. It's the biggest cost for many businesses. It's one of the heaviest financial burdens for families. And it slows down wage growth, economic mobility, and even productivity. Basically, healthcare is this huge, invisible tax that touches every part of American life. One of the most shocking numbers I've seen is this: the average American family spends around $27,000 a year on health insurance, whether they realize it or not. Many people only see the portion withheld from their paycheck. But employers also pay a huge chunk behind the scenes. The cumulative total is equivalent to buying a brand new car every year. That is insane. And the worst part? Most Americans still skip treatments, avoid going to the doctor, or ration medications, even while paying some of the highest costs in the world. So when we talk about affordability, healthcare isn't just one issue. It's arguably the issue. This is where things get complicated. Because it's easy to say healthcare is too expensive, but the reality is that the system is expensive for thousands of interconnected reasons. And one of the biggest reasons is lack of transparency. Now, I don't mean that in a philosophical way. I mean it literally. In America, doctors often don't know what their treatments cost. Hospitals don't publish their prices. Insurance companies negotiate different rates behind closed doors. Patients have no idea what they owe until months later. Employers paying the insurance bills have no idea what anything actually costs. And prices can vary by 500% or more for the exact same procedure in the same city. This kind of black box pricing does not happen in most other countries. It creates a perfect environment for waste overbilling, unnecessary intermediaries, administrative bloat, and sometimes even outright fraud. Some studies show that 30% to 50% of total spending in the system is administrative, not medical. Meaning the US may literally spend more money on billing paperwork than on doctors in some cases. Economists call this friction cost. Patients call it total insanity. So what is price transparency? In its simplest form, it means before you get medical treatment, you should be able to see the price, just like any other service in a functioning market. Supporters argue that, competition will drive prices down. Hidden fees will disappear, middlemen will shrink, patients will finally have power, employers will negotiate better deals, and overall costs will fall over time. Opponents argue that medicine isn't a normal consumer product. Emergencies don't allow price shopping. Higher prices don't always mean better care. Insurance complicates everything. Transparency alone doesn't reduce hospital monopolies, and hospitals may adjust prices upward instead of downward. Both sides have valid points. In reality, price transparency could be one useful tool, but it cannot fix the system on its own. Healthcare is too complex, too fragmented, and too essential for a single policy to fix everything. A lot of people who pay attention to US healthcare believe that price transparency is the key to fixing everything. This is partly true, partly oversimplified. From my perspective, transparency is necessary, but not sufficient. Yes, it helps. Yes, it empowers consumers. Yes, it pressures hospitals. And yes, it could reduce some administrative waste. But no, it won't fix the high cost of prescription drugs, hospital mergers and regional monopolies, the shortage of primary care doctors, emergency room dependence, chronic disease rates, legacy administrative complexity, medical lawsuits that drive defensive medicine. Let's talk about the real drivers behind rising healthcare costs, because they go way beyond billing practices. 1. Aging population. Older populations use more medical care, which is natural. 2. Chronic diseases. The US leads the world in obesity, diabetes, hypertension, and heart disease. 3. Hospital consolidation. Large systems buy smaller hospitals, reduce competition, and raise prices. 4. Drug prices. The US pays some of the highest prescription drug prices globally. 5. Insurance complexity. Every layer adds administrative cost. 6. Technology adoption. New equipment and treatments are expensive, even when beneficial. 7. Defensive medicine. Fear of lawsuits leads to more tests and procedures. None of these problems disappear simply because prices become transparent. So transparency may be a good step, but we need more than one step. If I were designing a reform plan, not as a politician, not as a partisan, but as a regular person who wants a system that works, it might include 1. Price transparency. Yes, but not alone. Patients deserve clear pricing. 2. Stronger antitrust enforcement against hospital monopolies. Competition only works if monopolies don't dominate. 3. More investment in primary care, Preventive medicine saves money long term. 4. Drug price negotiation. This is standard in almost every other developed country. 5. Simplification of insurance billing. Too many middlemen, too much paperwork. 6. Support for alternatives like direct primary care. More models, less dependency. 7. Tort reform. Reducing unnecessary defensive medicine. This is what a full-spectrum reform looks like, not just one idea. When you strip away the politics, Americans across the board, Republicans, Democrats, Independents, are all basically saying the same thing. I want to live a normal life without going bankrupt. That's it. It's not complicated. People want affordable premiums, reliable coverage, honest billing, straightforward prices, doctors who have time for them, hospitals that don't overcharge, medications that don't require GoFundMe campaigns. Most people are not demanding socialism. Most people are not demanding pure free market healthcare. Most people just want a fair system that works without needing a lawyer to understand it. But why politicians struggle to fix it? Healthcare has extremely powerful lobbying groups, hospitals, insurers, pharmaceutical companies, device manufacturers. They all have massive political influence. 2. The system is deeply entrenched. Changing anything requires rebuilding decades-old structures. 3. Voters want contradictory things. People want lower costs, better care, more choice, but also more protection, and no new taxes, and no reduction in services. These demands conflict. Politicians cannot satisfy all of them, so we end up with political band-aids instead of real solutions. After going through all the data, all the arguments, and all the opinions from both sides, here's my honest takeaway. Yes, healthcare is a huge part of America's affordability crisis. Yes, price transparency is a necessary reform. No, transparency alone will not fix everything. Yes, politicians often avoid deeper reforms because it's politically risky, and yes, Americans deserve a system that is simpler, fairer, and more affordable. I don't think this is a left-wing view or a right-wing view. I think it's a human view. If the United States is serious about fixing the affordability crisis, it cannot just blame one party or praise another. It needs to face the fact that the healthcare system has become so complex, so bureaucratic, and so expensive that it is actively holding back American families and the American economy. Transparency is part of the solution, but not the whole solution. Real reform will require courage. It will require bipartisan cooperation. It will require taking on powerful interests. And it will require listening to the actual lived experiences of American families. And honestly, if our political system can't handle that, then the affordability crisis isn't going anywhere. Thanks for watching. Thanks for thinking through this with me. And I'll see you next time.